we wrap up our discussion of the brain with some diseases and injuries. Epilepsy is a disease that is characterized by epileptic seizures. These are short, recurrent attacks of motor, sensory, or psychological malfunctions. Two types of seizures are absence seizures, where the person has a blank expression with a loss of consciousness. Generally, the person does not remember what occurred during this period of time, and they have a kind of a lights are on but no one's home type expression. They won't respond to anything, they'll just stare blankly. The tonic-clonic seizures are what we more commonly associate with epilepsy. It's a loss of consciousness with associated convulsions. There are other types of seizures as well, but these are two kind of main categories of seizures. These seizures are caused by abnormal discharge from neurons. So neurons are firing abnormally and causing these seizures. Epilepsy is often treated with anti-epileptic drugs, which tend to be fairly effective. Another disorder of the brain is a traumatic brain injury. Sometimes we also call this a concussion. The symptoms of a concussion are altered brain function following a blow to the head. If you have repetitive concussions, then cumulative damage can occur. This is one of the hot topic items with the National Football League and with college football, all the way down through the different levels of football, because football players tend to endure many blows to the head, some of which are concussions, and some, especially NFL players, experience cumulative damage from these repetitive hits to the head. We can also have a subdural or subarachnoid hemorrhage, either with or without a concussion. This is when we bleed into the spaces between the meninges and cause compression of the brain. If you compress the brain enough, it can be fatal. So this is a very serious condition, especially while the bleeding is still occurring. Cerebrovascular accidents include strokes and transient ischemic attacks. This is when we have ischemia, or lack of blood flow in the brain. This is generally caused by blood clots that block a cerebral artery, so the blood can't get up to the brain. One of the treatments for a stroke, especially if it is occurring at the moment, it can be treated with a clot-busting drug to dissolve the clot. One common drug is TPA, tissue plasminogen activator. Tissue plasminogen is an inactive enzyme that's present in our blood. We make it naturally. And when it encounters a clot, it should become activated and break down that clot. However, sometimes it's a little lazy and doesn't do its job, so it needs a little boost from a clot-busting drug in order to activate it and have it help out with busting up these clots. The faster we can restore blood flow to the brain, the less likely permanent damage will occur. Another cerebrovascular accident is a TIA, transient ischemic attack. This is when we have blocked blood flow for a short period of time. That's what transient means. And this can cause temporary numbness, paralysis, or impaired speech. And these transient ischemic attacks are an indicator that a cerebrovascular accident or stroke is highly likely. So many times if someone has one of these, it is accompanied by a fall due to the numbness or paralysis. And if it's identified, it's highly likely they will be put on drugs in order to prevent or attempt to prevent a stroke. Alzheimer's disease is a disease of those who are older generally. It is credited for about 100,000 deaths per year. About 11% of the population over 65 has Alzheimer's, and by the time you are 85, about 45% of the population will have Alzheimer's. So almost half of the population will have Alzheimer's by the time they are 85. Signs of Alzheimer's include memory loss for recent events, individuals can be moody and combative and gradually lose the ability to talk, walk, and eat. Those with Alzheimer's disease show deficiencies of acetylcholine and nerve growth factor. These are two areas where treatments are being targeted. The diagnosis of Alzheimer's is only confirmed at autopsy, and since many of these individuals don't have an autopsy, the diagnosis of Alzheimer's disease is often not confirmed, but suspected from a group of symptoms. At autopsy, those with Alzheimer's disease have atrophy of the gyri or folds of the cerebral cortex. You also find neurofibrillary tangles and senile plaques within the brain. Another hallmark is formation of a protein, beta amyloid, due to the breakdown of plasma membranes. So as cells die and break down, this beta amyloid is produced. Genetics is implicated in Alzheimer's disease, and one of the treatments is to halt beta amyloid production. However, the research was halted due to serious side effects. Another treatment is to give nerve growth factor or cholinesterase inhibitors. If we inhibit the enzyme that breaks down acetylcholine, the acetylcholine sticks around for a longer period of time and is able to do its job. If we take a look at the brain of someone with Alzheimer's, you can see the shrunken gyri and the wide sulci that are characteristic of Alzheimer's. And if we take an electron micrograph, we can actually see the tangles and plaques within those neurons and other neural tissue within the brain. Parkinson's disease is a disease of motor function. So it's a loss of motor function. It normally begins in someone's 50s or 60s, and there generally is no recovery. There is early onset Parkinson's that can begin earlier. Parkinson's is due to a degeneration of dopamine-releasing neurons. Dopamine is a neurotransmitter that normally prevents or inhibits excessive activity in the motor center and basal nuclei. Because this activity is not being inhibited, we see involuntary muscle contractions, like a pill rolling motion with the fingers, facial rigidity, slurred speech, illegible handwriting, and a slow gait. Treatment for Parkinson's includes both drugs and physical therapy for the motor function. They can give a dopamine precursor called L-DOPA or levodopa, and it will cross the blood-brain barrier. The only problem is it has negative side effects on the heart and liver. They can also give these individuals an MAO inhibitor. An monoamine oxidase breaks down dopamine. So if we inhibit the enzyme that breaks down dopamine, we'll have more dopamine around. This helps to slow neural degeneration. There's also surgical techniques to relieve some of the tremors associated with Parkinson's. This wraps up our discussion of diseases and disorders, and next we'll take a look at the cranial nerves.